Right now, as you're watching this, there is something happening inside your feet. Something slow, something silent, and something most people completely ignore until it's too late. Here's what I mean. A foot ulcer caused by diabetes has a 5-year mortality rate of roughly 30%. Let me put that in perspective for you. That is worse than several common cancers. A sore on your foot, not your heart, not your lungs, your foot. And here's the part that keeps me up at night. You might not feel it happening at all. Today, I'm going to walk you through 9 warning signs your feet are giving you right now that could mean diabetes is already doing damage. And sign number 5 is the one that hides in plain sight. Most people look right at it and think nothing of it. So stay with me. This could change everything. My name is Dr. Nathan Wells, and I've been practicing medicine for over 20 years with a focus on senior health and preventive care. And what frustrates me most as a doctor is watching patients walk into my office with a foot problem that started as something tiny, a little numbness, a patch of dry skin, and by the time they come to see me, we're talking about serious infections, hospital stays, and sometimes surgery that could have been completely avoided. That is why I made this video. I don't want that to happen to you. Just last month, a patient of mine, Robert, 68, a retired structural engineer who spends his weekends building beautiful furniture in his workshop, came in because his wife noticed a strange smell coming from his foot. Robert told me he had stepped on a small rogue screw a few weeks earlier. He felt a dull pressure, nothing sharp, so he figured it was just a callus forming. He never checked the bottom of his foot. When I removed his sock, what I saw was a deep, infected wound. The screw had created an opening that bacteria had been feeding on for weeks. Robert had no idea because he couldn't feel it. He had advanced diabetic neuropathy, nerve damage from blood sugar levels he didn't even know were high. Robert spent 6 weeks on intravenous antibiotics and lost his second toe to stop the infection from reaching the bone in his leg. A tiny screw. That's all it took. So today, I want to make sure that doesn't happen to you. The Centers for Disease Control and Prevention reports that 28.8% of adults age 65 and older have diabetes. That's more than 1 in 4. And here's what's even more unsettling. Over 11 million American adults have diabetes right now and don't know it. You could be one of them. Your feet might already be telling you. The question is, are you listening? Sign number 1, the invisible sock feeling, and this is where it usually starts. My patients always tell me, Dr. Wells, my feet just feel tired. I figured it was age. And sometimes it is. But if your feet constantly feel like they're wrapped in a thick sock even when they're bare, that's not fatigue, that's nerve damage. Here's what's happening. High blood sugar is like liquid sandpaper flowing through your bloodstream. Over time, it scrapes and destroys the tiny blood vessels that feed your nerves. The longest nerves in your body run all the way to your toes, and they're the first ones to starve and die. Think of it like the electrical wiring in an old house losing its insulation. The signal from your toes to your brain gets weaker and weaker until it disappears completely. A CDC report found that loss of protective sensation precedes 60 to 70% of diabetic ulcers. Here's what you do tonight. Close your eyes and have someone lightly touch each of your toes with a pencil eraser. If you can't tell which toe they're touching, call your doctor. Not next week, this week. Sign number 2, burning or zapping pain at night, and this one robs people of sleep. I hear this constantly. It's just restless legs, or I get cramps from walking too much. But burning, electrical, shooting pain in your feet at night, that's not a muscle problem. That's your damaged nerves misfiring. They're sending pain signals to your brain even though nothing is touching your foot. I always explain it to my patients this way. Imagine a fire alarm in your house that is short-circuited. It blares at 3 in the morning, full volume, even though there is no smoke and no fire. That's what your nerves are doing. The World Journal of Diabetes confirms that hyperglycemia-induced nerve damage is the primary driver of these spontaneous pain episodes. Here's your action step. Do 5 minutes of gentle ankle circles before bed every single night. It encourages blood flow to those starved nerves and can reduce the misfiring. Start tonight. Sign number 3, constantly cold feet, and this one fools almost everyone. Poor circulation runs in my family, my patients say. Or, the house is just cold. But if your feet are always cold, even under blankets, even in summer, that could be peripheral artery disease, PAD, narrowing the blood vessels in your legs. Think about the heating system in your house. The rooms farthest from the furnace never get warm if the ducts are clogged with dust and debris. Your feet are the rooms farthest from your heart, and if the arteries feeding them are blocked with plaque, warm blood simply cannot get there. Wear loose, padded, non-restrictive socks. And here's a critical warning. Never use a heating pad on numb feet. If you can't feel temperature properly, you can burn your skin without knowing it, and that burn can quickly become a wound that won't heal. Sign number 4, severely dry, cracked heels, and most people blame the weather. It's just winter skin, Dr. Wells. I hear it every week, but diabetes doesn't just damage the nerves that control feeling. It also damages the autonomic nerves, the ones that control automatic functions like sweat and oil production in your feet. When those nerves fail, your skin loses its ability to lubricate itself. It's like running a car engine without any oil. Eventually, the friction causes the parts to crack and break. Those deep cracks in your heels are open doors for bacteria. Apply a urea-based moisturizing cream to your heels every single day, but never between your toes. That trapped moisture breeds fungus. Start today. Now let me pause here for just a moment. Have you noticed any of these signs in yourself or someone you love? If you have, go to the comment section right now and type yes. Just yes, capital letters. I read every single comment on this channel, and I want to know what you're experiencing. And if you're finding this useful so far, hit the like button right now. It takes 1 second, and it tells YouTube to show this video to more people over 50 who need to hear this. All right, let's keep going, because sign number 5 is the one almost nobody catches. Sign number 5, loss of hair on your toes and feet, and this is the one that hides in plain sight. Here's what nobody tells you. Look at the tops of your feet and your big toes. Do they look unusually smooth and shiny? Did there used to be hair there that's now completely gone? Most people say, well, you lose body hair when you get older. And yes, some thinning is normal, but complete hair loss on the feet and toes is a circulation red flag. Hair follicles need a steady blood supply to survive. When PAD chokes off blood flow to your extremities, your body triages. It sends blood to the essential organs and lets the hair follicles at the very edges die. I always explain it this way. Imagine a lawn with a sprinkler system that's losing water pressure. The grass at the very edges of the yard is the first to turn brown and die because the water can't reach it. That's your toes. Take off your socks right now and look at your big toes. If they used to have hair and are now completely smooth, mention it at your next checkup. Sign number 6, slow healing scrapes or bug bites. My skin is just thinner now. I understand why patients think that, but if a small cut or a bug bite on your foot looks exactly the same after 2 weeks, that's not thin skin. That's your immune system failing to do its job. High blood sugar impairs your white blood cells, the repair crew your body sends to fix damage. It's like trying to patch a pothole on a busy highway during a blizzard. The crew can't get to the site, and even if they do, they can't work. A study in JAMA found that 50 to 60% of diabetic foot ulcers become infected, and 20% of those infections lead to amputation. Follow the 14-day rule. If any wound on your foot hasn't improved after 2 weeks, see a doctor immediately. Sign number 7, thick, yellow, crumbly toenails. Most people assume it's just a fungal infection from a pool or a gym. And it might be, but diabetics are extremely susceptible to fungal infections because high blood sugar creates a feeding ground for yeast and fungus, while poor circulation prevents the body from clearing it out. Think of mold growing in a damp basement with no ventilation. It thrives because nothing is fighting it. Have your toenails trimmed by a podiatrist. Never use over-the-counter acid treatments or dig at the nails yourself. Those tiny cuts can become the entry point for a devastating infection. Sign number 8, calf cramping while walking. I'm just out of shape. That's what patients say. But if your calves cramp or ache after walking a short distance, and the pain completely stops when you rest, that pattern has a name: claudication. It's a hallmark sign of PAD. Your leg muscles are screaming for oxygen that your clogged arteries can't deliver. It's like a car engine sputtering when you try to drive uphill because the fuel line is choked off. Keep a symptom journal this week. Write down exactly how many minutes or blocks you can walk before the cramping forces you to stop, and bring that journal to your doctor. Sign number 9, changes in foot shape, and this is the one that sends patients to the emergency room. My arches are just falling. No. If you notice your foot changing shape, getting wider, flatter, developing a rocker bottom look, that could be Charcot foot. Severe neuropathy has prevented you from feeling the microfractures happening in your foot bones every time you walk. You're literally walking on broken bones, and you don't know it. The foundation of a house slowly sinking into soft soil. That's what's happening to the structure of your foot. The frame warps, the joints collapse. Check the bottoms of your walking shoes right now. If the tread is severely worn on one side, your foot mechanics have changed, and you need an evaluation immediately. Now, I want to tell you about Maria. Maria is 72, an active grandmother and an avid gardener. One day, while getting a pedicure, she noticed the tops of her feet looked unusually shiny, and the tiny hairs on her big toes were completely gone. Her feet also felt cold at night. Instead of ignoring it, Maria brought it up at her next appointment. Her tests revealed an HbA1c of 6.2, that's prediabetes, and early-stage peripheral artery disease. Because she caught it early, before the nerves died, Maria reversed her prediabetes entirely through a daily 30-minute walking routine and dietary changes. She restored the circulation to her feet. Robert lost a toe because he didn't check. Maria saved her feet because she paid attention. Tonight before bed, I want you to do one thing. Place a small hand mirror on your bedside table. Sit on the edge of the mattress and use that mirror to look at the bottoms of your feet. Check for any cuts, red spots, or blisters you can't feel. And at your next doctor's visit, ask for 3 tests: the 10-gram monofilament test to check your foot's nerve sensation, the ankle brachial index test to check for blocked arteries, and an HbA1c blood test. You worked hard for your independence. Don't let a preventable foot complication take it from you. If this video helped you, I need you to do something for me. Share it on Facebook right now. Tag your spouse, your sibling, your best friend, anyone over 50 who needs to hear this. You might be the reason they check their feet tonight. And if you're not subscribed yet, subscribe now. I post a new video every week on the topics that matter most for your health after 60. Subscribe and bring someone you love along with you. I'm Dr. Nathan Wells. Stay aware, stay proactive, and take care of yourself. I'll see you in the next one.